Hey there, this is Dawn Thompson from ImprovingBirth.org, and we are a nonprofit organization working to improve maternity care for consumers. I'm here with Dr. Chavira from Los Angeles. He's a maternal fetal medicine doc and is, just doing his thing in LA. We are here. Welcome to our very first video blog. So forgive us if we screw it up a little bit, but it's our first go. And today, the reason that we're here is we're trying to cover consumers or situations that consumers find themselves in our current maternity care system. The system being the operative word. And today we're going to talk about the long and short-term risks of cesarean delivery for both moms and babies. It's oftentimes women are not given all of the information. And what we want to do is arm them with more information so they can make the best choice for them. The first thing I want to say is this is not an anti-cesarean video. We believe in videos. We believe in videos. We believe in cesareans when medically indicated. He does them regularly when they are appropriate. So that's not what this is about. Nor is it to make women who have had cesareans feel guilty. This is for women who are making decisions about their care in the future. So with that being said, hey.
Hi. So yeah, I'm very excited that we're doing this. Been kind of preparing this for a while, so now the moment has arrived. But yeah, I'd just like to reiterate the point that this is not an anti-cesarean discussion. And like you said, I have done many cesareans and will continue to do them. I recommend them when I feel that it's the safest way to go. Um, but I do have the sense or the perception when I have conversations with patients, sometimes with labor and delivery nurses, sometimes with OB/GYN doctors, that the cesarean is really kind of no big deal. There sometimes feels like there's a real nonchalance about it, and sometimes I get the sense that people's view of this is that whether you have a vaginal birth or a cesarean birth, it's kind of the same. Mom and baby both leave the hospital alive, and they commonly say, well, healthy mom, healthy baby, and
That's all that matters.
it sort of seems the same. But my view is that they're actually there are some significant and important differences between a vaginal birth and a C-section, and there's some consequences down the line that I think maybe are not always fleshed out as well as they could be, and uh, I think it's helpful to sort of have all this information in mind when making decisions.
So for instance, let's talk about some of the short-term risks to mom, because I think these are things that are often covered, and it's usually the only thing that's covered.
Yeah.
So
Yeah.
let's talk about that.
And yeah, let's do that. And one last thing that I would like to say just about the consent process in general is that what I might tell a patient, it kind of depends on the scenario. There are times where you really have an emergency and you got to move, and you don't have the luxury of taking 30 minutes to go through all of this. So sometimes if a full discussion doesn't happen about all these things, that may very well be appropriate depending on the circumstances. There are other cases where, it's not an emergency and you really can take all these factors into account and really weigh everything, and it becomes more appropriate. So in a setting like this, we're just sitting here talking, we can maybe get into a little more detail about the things that might be, short and long-term implications of a C-section.
Well, but some people are making these decisions because they're about to have a VBAC, or they have a choice of having a VBAC or a cesarean birth, and so they have long periods of time to make these decisions.
To think about it.
Yeah, and so that's really the people that we're talking to,
right.
Or the ones that are being encouraged even with their first baby because they're going to have a big baby or whatever. And we will talk about those things in other episodes. Because that's a whole nother episode altogether. But some of these women are being told, hey, you should just go straight to cesarean. So they do have time to disseminate this information. So
right, yeah. So you asked me about the short-term issues for the mom, and I think, like you said, I think these things usually do get covered, even if in a very cursory way. But some of the basic risks of a cesarean delivery. You typically lose a little more blood than you do with the vaginal birth. It's not usually enough to really cause a problem to the mom. The the frequency with which you might lose so much blood that you end up needing a transfusion, for example, that's going to be a lot less common. Um, you can have organ injuries, because you are going into the abdomen and stuff that's in the area, or things like the bladder, the uterine arteries. Less commonly, you might get into the urine tubes that are running from the kidneys down to the bladder, or maybe the intestines. That would be particularly uncommon in a first C-section. It might be a slightly higher risk for somebody who's had a lot of surgery before, and things might be, scarred in the wrong place. But organ injury goes on the list. Um, Sometimes there are issues with the way the wound heals. A wound may not heal completely the first time around and may require drainage, or it may need to be opened. And then those wounds will be left open and they'll kind of close themselves over a matter of days to weeks.
That's probably one of the more frequent things that I hear about.
Yeah, it's not terribly uncommon. It's also not terribly dangerous, but it's can be painful, especially the first few days of that, and it's usually disturbing to the moms
Well,
and
I was just going to
families.
say, and it also can lend itself to some of the depression issues that we're going to talk about in a minute too,
Yeah,
that women suffer from.
yeah, certainly. And one of the short-term issues for mom that I have a sense is very often not mentioned is an issue called venous thromboembolism. So that means blood clots, which will commonly form in the legs, and then may spread to the lungs, or may form, primarily in the lungs. Um, so again, this falls into a category of a sort of an uncommon complication, but by no means unheard of. It's very clear, it's very well known that the chances of that happening, it's definitely higher after a C-section compared to a natural birth. So, um, and in terms of really dangerous events that happens to mom, historically it used to be, hypertension, infection, and hemorrhage, and we've gotten better at dealing with those issues. And now one of the leading causes of maternal mortality is actually venous thromboembolism, big blood clots in the lungs. So it's a thing that happens, fortunately, to a small number of women, but if it happens to you, that's a very significant issue. And I think that's one of the things that's not commonly part of the discussion when we're deciding on a C-section versus trying for a vaginal birth.
So what about the short-term risks to baby?
Yeah, so I'm really glad you asked that, because another sense that I have just from conversations with people is that that the C-section is really done to protect the baby, and I think people in general have a sense that there may be some risks that the mother endures, but it's for the benefit of the baby. And the feeling is that delivering by C-section, you're just guaranteed a nice, gentle delivery for the baby. And you know, uh, by and large, that may be true, but nothing is absolute, and there are complications that can happen to a baby in the short term from a C-section. So one of the experiences I have when people get a chance to witness a C-section is they're often very surprised that it's rougher than what you might imagine.
Yeah, I remember that actually for myself. My first cesarean, I remember feeling like, oh my gosh, they are shaking my body and moving my body so much. And I remember, I mean, it actually made me feel sick because they were moving me around so much. And I remember thinking, holy cow, thinking that it shouldn't have been that.
Yeah.
I didn't anticipate that at all.
Yeah, it is a little rougher than you might expect, and sometimes all of us OBs who do these C-sections have all had cases like these where you struggle a little bit to get the baby out, and it's anxiety provoking, and it's very stressful, and you kind of feel like you really only have maybe about a minute or a couple of minutes to get the baby out before we start to get into some kind of trouble. So, babies sometimes will be bruised during a delivery. There's even sometimes fractures happen. I've had a case like that where, an arm fracture on a baby during a difficult delivery.
Mm.
There were some fibroids there in the uterus that, we didn't know about, and, it just made for a difficult delivery. Once in a while, baby can actually get lacerated by the scalpel, and
Right, I've heard of that.
the most common ones are just
Crazy.
there's just little these little nicks on the cheek, and maybe that's not too big a deal, but I've certainly heard of cases of really significant lacerations. That might be more common in a emergency
Crash, right?
scenario where people are just kind of very stressed and moving as quickly as they can, but there are certainly things that can happen to a baby in the short term, from a cesarean delivery. And I think sometimes we may not think about that. We just think
Yeah.
it's, the baby's sort of removed like a delicate little flower, but it
Right.
doesn't quite happen that way.
Mm-hmm. And that leads us straight into the long-term things. And I think maybe we should start with the long-term risks for babies, since we're just dropping off on that, because I think there's so many things that people don't consider from the long-term standpoint, including often the provider who's doing the procedure. Because like we said earlier, that, happy mom, or I mean, alive mom and alive baby, and they leave the hospital and we're done. We did our job, right? And they don't worry
We
about
won.
the rest. Yeah,
Yeah.
we won. Everybody's alive.
Yeah.
We're good.
Yeah. And yeah, absolutely. And I think this is an area where our understanding and our knowledge is actually evolving. I think, previously we didn't have any idea about this. There was the sense that, mom and baby wheeled out of the hospital a couple of days after C-section, and everything is golden. But now it's becoming clear that there are long-term health impacts as a consequence of how you were born that we're now beginning to appreciate. And there are multiple studies now looking at children down the line, and there's even at least one I'm aware of looking at adults, and comparing babies that were born by C-section versus babies born naturally. And it seems to be pretty clear that if you're born by C-section, there's a higher chance of health problems like obesity, diabetes, asthma, and some other allergic conditions. And it's not a small difference. It's something
and bronchial issues too, right?
It's something
more,
like a 50% difference. So
yeah, it's pretty significant.
Yeah, and I mention this to patients, and very often the response is shock, and it doesn't quite make sense. And how might that happen? And I think what people are starting to figure out is it has to do with the bacteria that move into your intestine, which we used to think in the past were sort of annoying, innocent bystanders, but we're now starting to realize they're actually very important health and physiologic functions of the bacteria that live in your intestines. So, I mean, they're producing enzymes and hormones, they're digesting your food, they're interacting with your immune system, they're really very active. In a sense, this is like an organ. And it's been demonstrated that when babies are born vaginally through the birth canal, all the mom's healthy bacteria move in and set up camp, if you will, in the baby's intestine. And this is sort of a normal, natural process.
Right. So when they're coming through, essentially, I just want to kind of put a little layman term on it, because not everybody's going to understand what you're saying, but essentially the good bacteria goes into the vagina, the baby passes through and absorbs those things through their skin, through their nostrils, through their mouth, through their ears, like in every skin, all of it, and it does go then into their bodies. Because then I think that's kind of like, well, how does that work if they're just passing through? But that's it, right? I mean, it's essentially absorbed through the skin and every orifice of the body.
I think we don't know yet exactly how it happens, because there are people now trying to recreate this, and so I think that hasn't all been worked out exactly how it happens, but it's pretty clear that it happens, because when they look at the organisms that are living in the baby's intestines later, they're very different if you've been born vaginally versus if you were born by C-section. Because, you know, you're born by C-section, you come out through the mom's belly, through the skin, you sort of bypass the vagina or the birth canal. And so this may very well be related to these health uh, effects that we see later in life.
Mm-hmm. The diabetes, right, got it. And so let's talk about the long-term effects on the mom.
Yeah. Um, so again, very, very important, and I think often overlooked. You know, some conscientious physician may sit down and talk about the risks of the C-section, um, but it'll be a short-sighted conversation where we're really talking about the risks of this C-section. And what gets left out of the conversation is, well, what about the next pregnancy? And then the third pregnancy, and then the fourth pregnancy. Um, so when you have a C-section, theoretically, you have the option to make an attempt at vaginal birth in the next pregnancy. The American College of OBGYN states that that's a safe and reasonable option for most women. But the reality is that women who might be interested in trying to do that, we're going to face a lot of barriers.
Yeah.
Some providers don't feel comfortable with it and will tell the patients no.
Well, I've heard that VBAC is a terrible business decision for providers. And I think, we're going to have to go into VBAC in a whole nother episode because
Yeah.
that is an independent subject all on its own. But, what we do know is that a significant number of hospitals around the country either ban them altogether,
Right.
or they have a pseudo ban, which just means there aren't any providers in the hospital that will do them.
Yeah.
And the biggest barrier that we see for VBAC though is that providers say they will do VBACs, but they have all these arbitrary guidelines like, well, you've got to do it by 39 weeks, you've got to have an epidural in place, you've got to have it, like you need to come in as soon as you go into labor, like all these arbitrary things. Yeah, they're very restrictive, and none of which is supported by evidence.
Yeah.
Right? None of it is showing. It's really guided by provider preference and not anything to do with what's best for mom. So I just wanted to touch on that a little bit.
And the main point of that is that you may have your cesarean and say, well, I can just have a VBAC next time, and I'll just end up with one C-section. But the reality is that 90+% of women who have a C-section are going to have another C-section in the next pregnancy.
Yeah.
So the cesarean just needs to be understood as a surgery that leads to more surgery.
Right. And I think the statistic actually is 90% of all women will have all future children.
Yeah.
By cesarean. So I just want to clarify that stat.
Right. So, depending on how large you are imagining your family is going to be, this may be 2 cesareans, 3 cesareans, 4 cesareans, and I take care of women that have had a large number of cesareans like that. The complication during the surgery, maybe it's not in this C-section, maybe it's in the next one.
So let's talk about what that is, because placenta accreta is the main concern, and after each C-section that risk goes up significantly, right? So let's talk about what that is. What is placenta accreta, and how dangerous is it?
Yeah. So that's the main one. There are other issues with recurrent C-sections, but this would probably be the most dangerous one. And so what that has to do with is when you start the pregnancy actually starts in the fallopian tube, and it works its way through the fallopian tube. It ends up in the uterus. When it gets to the uterus, it can attach anywhere in the uterus. It can attach at the top, at the front, at the back, on the side. But there are some times where it attaches down low, very near where the C-section scar is. And so if the placenta starts growing right over where the C-section scar is, what can happen in a thankfully small number of cases is the placenta will start to invade into the scar and into the uterine wall, so it's abnormally attached. What's normally supposed to happen with a placenta at the time you deliver, and if you think about this, always blows my mind how Mother Nature has designed this, but the placenta is firmly attached to the uterus through the whole entire pregnancy. The mom falls, hits her belly, no problem. She gets in a car accident, no problem. The placenta hangs on. And at the time of birth, the baby's born. Somehow the placenta knows that its job is done, pops off, and delivers.
Right.
So that's just always been so incredible to me. But with the placenta accreta, it is abnormally attached to the uterus and it is not going to
come out.
Detach. You can imagine it's just buried deep into the uterine wall. And in fact, there are some extreme cases of this where it actually goes all the way through the uterine wall and sometimes into other nearby body organs, for example, the bladder. That's called a placenta percreta, which fortunately is even more rare. So, you know, the good news is most women who have multiple cesareans will not face this problem. But if that happens to you, the risk of this pregnancy and the risk of the
mother's life
of the delivery has now gone tremendously up.
Right?
Yeah. So the way we have to deliver these babies is, first of all, we deliver them a little bit early because you don't want to wait around for mom to go into labor because that could be a potential disaster. So we're going to deliver them a little bit early. So now you're delivering your baby just a little bit preemie. Fortunately, the risk associated with that to the baby are small, you know, but not zero. So this is an effect on your future baby of having had a cesarean in the first place, is your future baby now is going to be born just a little bit early. But because this placenta will not detach, what you basically do is you do the C-section, you deliver the baby, and then you remove the whole uterus. You do a hysterectomy. So this is referred to as a cesarean hysterectomy. Now, a cesarean hysterectomy is a huge surgery, much, much more significant than a C-section. I mean, honestly, in comparison, a C-section is a tiny surgery. The cesarean hysterectomy takes a lot longer. You generally have a very significant blood loss. I almost always see blood transfusion with the cesarean hysterectomy, and occasionally massive transfusions. And there's a lot higher risk of injuring other organs, particularly the urine tubes that run from the kidneys to the bladder. So that's a lot more of a risky scenario and a much, much bigger deal. And I think it's something that's rarely mentioned. When, you know, if we are talking about planning a delivery and there's maybe some risk of the vaginal birth that we're worried about, like maybe it's big baby and we're worried about birth trauma, or maybe it's a mom with a prior C-section and we're worried about that scar tearing open while she's in labor. So we think about those risks, but we may not talk about or think about the risks involved with going down that road of, you know, multiple cesarean deliveries.
So let's talk about, though, the risk of the other, you know, secondary risks, which I think are even less talked about than some conscientious doctors might talk about the long-term risks of the accreta and, you know, infection and those sorts of things. But what they're not talking about is depression, issues with depression, and how it affects breastfeeding oftentimes.
Yeah. Yeah. So depression, you know, postpartum depression. First of all, it's a common problem, and it's simplistic to say that you're going to have a vaginal birth and you won't deal with depression. You're going to have a C-section and you're going to be depressed. It's by no means anything that simple, but it does seem to. It is known that C-section is a risk factor for postpartum depression, and I think. You know, I don't want to be simplistic about these things. It's it may not be a matter of the C-section causes depression. It could be a very complex mix of the circumstances that led to the C-section might be more related to why the depression happens, but it's just another thing to add on to the list of things that are associated with cesarean delivery is postpartum depression.
A higher risk or a higher number occurrence of it.
Yeah. The breastfeeding, I think it's a little easier to understand how the cesarean delivery is tied to impaired breastfeeding.
Yeah.
So again, not to be simplistic about things, you can have a vaginal birth and struggle with breastfeeding.
Right.
You can have a cesarean delivery and
no
breastfeed
issues.
magically
Right.
with no problems. Um, but it is established without any question that if you have a cesarean delivery, your chances of having difficulties with breastfeeding are going to be higher. Your success with breastfeeding might be a little bit lower.
Mm-hmm.
And it happens for a lot of reasons. So first of all, uh, there's very commonly a separation between mom and baby
Right.
With the cesarean delivery. And it's so common for moms to describe that the baby's swaddled and brought over to them and they get to kiss the baby and then the baby's
And that's it.
whooshed
Yeah.
off to the nursery.
Right.
And they may not have their first contact with the baby until maybe an hour later, sometimes, multiple
3 and 4
hours later.
Yeah.
So the separation between mom and baby at the time of birth is a thing that clearly has a harmful impact on
Right.
breastfeeding
It's very well
success.
documented at this point. Yeah.
Yeah. It also may just be physically uncomfortable to,
Right.
hold the baby on your lap. You've got, the scar on your abdomen. I think, as I'm doing a cesarean delivery, I can hear the conversations between the mother and the anesthesiologist, and I am very often impressed by the compassion of the anesthesiologist and just sweetly and lovingly offering the mother, pain medications because she's uncomfortable with what's happening with the surgery. So then the mom is given, some medications for pain control, maybe to make her a little bit sleepy, so that by the time we get to the recovery room, mom is just zonked.
Right.
And that's not maybe out of anybody's malicious intent. They're really, providing compassionate care.
Right.
But again, one of the downstream effects is doing something that might be putting another hurdle for the breastfeeding success.
Mm-hmm. Well, the other thing I wanted to just touch on too was the another thing from that I see with babies and moms and how it affects the breastfeeding relationship is there's also a lot of discussion now going on about how much IV fluids a mom is typically receiving during a long labor, right? And that ends in a cesarean birth, which then they're really pumped full of fluids towards right there, right before surgery. And they're weighing the baby when the baby comes out, but baby has been a part of mom, and so that baby is full of fluids as well. And they're going for a weight, and then a day or two after the delivery, there's this, panic because the baby has lost a significant amount of weight. And so now the interventions have started. Let's give them formula. Let's, like whatever, doing some sort of intervention and telling the mom that she's not making enough milk when the reality is she's not even supposed to be making milk yet. She's making colostrum only, and the baby has a very small stomach. And so those are some of the long-term effects, or the short and long-term effects that I see that affect breastfeeding, is that we're inaccurately weighing the baby to begin with,
right,
and then responding inaccurately to what we think has happened, which is not a reality in the first place. So.
And I've seen some papers on that, some pediatric papers, and I don't think it's I don't think taking that into account is standard yet.
Yeah.
I think this is sort of an emerging concept where people are beginning to realize, we might be overestimating that initial weight loss and going too quickly to the formula, which is known, to cause problems with the breastfeeding. And also, it's known that formula feeding has an impact on the bacteria in the baby's intestines.
Right.
So very often you get a cascade of events because first you have the cesarean birth, so the initial bacteria that the baby gets exposed to is different. There's some antibiotics you get exposed to in order to minimize the risk of infection in the mom. That's known to affect the intestinal, the population of bacteria in the intestine. And then we may have difficulty with breastfeeding, and so we introduce formula, and that's known to affect the
Right.
intestinal organisms. So there's sort of one hit
Snowball, right? Yeah.
after another, um, and maybe all of this contributing to what we see later, which is this, you know, significant increase in health problems later in life.
Great. Well, thank you for today. Thank you guys all for joining us. I think this will wrap it up for our very first episode. It's our first episode. I hope you enjoyed it and got some good information. Please share and visit us at improvingbirth.org and on Facebook, Twitter, you name it. Pretty much every social media outlet is Improving Birth. And we'll hopefully be doing a lot more of these and arm you guys with some great information. Have a great day.
Thanks, Don.
Thanks.